Hello, my name is Jeff Maneval. I'm one of the neurology residents of third year at the University of Vermont Medical Center based out of Burlington. And I'm here to talk to you guys about a very interesting case presentation that I had while I was on service. It's an isolated case of pachymeningitis that's secondary to ANCA-positive necrotizing vasculitis. So I had a 65-year-old gentleman who presented with a subacute onset of headaches and a gait disturbance to the point where it was pretty serious. He went from having being completely ambulatory to being confined to crutches and a walker in just over 2 months. And when he presented to us, he presented with a meningitis that wasn't responsive to any of our medications. And so what we eventually found out and diagnosed him with is a very new entity that's just being discovered and described, that's mostly coming out of Japan, called isolated pachymeningitis, or a meningitis that is confined just to the outer membranes of the meninges called the dura. And this pachymeningitis is due to an autoimmune inflammation of the dura, consistent with a rheumatologic disease called ANCA-positive pachymeningitis. There's a lot of controversy and changing of the guard in a case with this emerging entity that's currently being described worldwide, with only a handful of cases ever been biopsy confirmed. So this disorder kind of goes between two different related conditions: granulomatosis with polyangiitis, formerly called Wegener's, which is associated with granuloma formation, and microscopic polyangiitis, which is very similar but without the dural inflammation. So the fact that this entity exists and is not a sequelae of long-standing granulomatosis with polyangiitis, but in fact can stand on its own, is an entity that we haven't really seen before, and previously has fallen under the diagnosis of idiopathic pachymeningitis. The other very interesting thing is that this kind of cuts through some uncertainty in the rheumatologic world between a couple of different diagnoses that are probably the two sides of the same coin, that a microscopic polyangiitis and a granulomatosis with polyangiitis are basically two versions of an underlying vasculitic disorder that we really don't have a good name for yet and is just currently being described. Finally, this project is pretty exciting as well because it also points out the different chemical and immunologic makeups of the different areas of the spinal cord. The fact that you can have an outbreak just in the outer part of the meninges, only in the central nervous system, so around the brain, tells us a lot. It tells us that that area of the brain is very different in terms of the cytokine and molecular architecture than is the outer part of the spinal cord, or the arachnoid membrane, or even the pia, or possibly even within the white matter or gray matter of the brain parenchyma itself. So this is a very exciting case report that documents not only molecular targets for possible future therapies, not only talks about the different underlying physiology of the different layers of the brain and the spinal cord, but also describes a new clinical disease that hasn't been formally described, and is pretty heterogeneous in its makeup. So it's a very exciting project, and I'm looking to see what comes out over the next couple of years. So I'm a neurology resident at the University of Vermont Medical Center, and I'm not quite sure what my future plans are going to be. I'm very interested in multiple sclerosis and neuroimmunology, but I'm also very interested in the brain and behavioral neurology. It always struck me as amazing to be able to study the interplay, basically the hard problem of consciousness, how the physical brain can create the mind. And for me, the interplay of how lesions in the brain, such as those in multiple sclerosis or stroke or anything else in neurology, can cause behavioral side effects, can cause people to completely change their personalities and who they are. It's very interesting to see how different parts of the brain, when you break them down, you're able to kind of take away from the whole, and to see how our personalities and our lives and our experiences and our outlooks on the world are all based on this tiny, almost jelly or sponge-like substance that's in our skulls is amazing. I'm looking forward to discovering as much as I can about it.